Alrighty. Well, if you're ready, Steve, I'll start with a bit of an introduction, then we can jump on over. Thanks once again for those joining us for our next in a series of webinars of our ATS University. For those that maybe haven't joined before, my name is Zach Allison. I'm the ATS Market Development Manager for Canada. Today, we're going to be discussing a pretty interesting topic, and we've got some of the industry experts on the line with us from the Morris Lee Group. Either Morris Lee in Canada or the Whitehall Group down south. As with a number of different webinars that I'm sure everyone's pretty familiar with these days, we're going to have this recorded so that we can host it and send it out afterwards. And of course, we do have everyone muted upon entry. However, I'll be keeping an eye on the chat and the QA field. So if you do have questions along the way, please feel free to bring them up. I'll wait for a good break for you, Steve, and bring up any sort of questions as they come up so I don't interrupt you. I guess without any further ado, thank you very much for joining us. We're very happy to have the relationship with Whitehall and with the Morris Lee Group, because there are a number of unique products that you have that fit specific applications in the market. So yeah, I guess with that, I'll pass it over to you, and thanks again.
Thanks, Zach. I appreciate the opportunity to speak to everyone. And it's not always the easiest topic. Behavioral health, kind of, as we'll discuss, strikes a lot of different people. It's not always the easiest conversation, but it's something that's really important, and it's really good to talk about. So Best Care is just a little introduction. Best Care is the behavioral health product group from Whitehall Manufacturing. Whitehall Manufacturing is a part of a larger organization called Morris Group International, and Morris Lee there in Canada is part of us. And we at Whitehall focus strictly on healthcare and in particular behavioral health. So just as an introduction, so this is ligature resistant solutions for behavioral health. And we'll touch on, I'll refer back to this picture you see behind here. This picture where it says Hope is the reception area of a behavioral health facility in Grand Rapids, Michigan. And, we'll talk about this a little, but you can imagine if you're a patient or a family member or a visitor coming in to see a loved one, when you walk in the building, this is what you see is Hope. And it's a little different from some of the other pictures that you'll see. So just keep this picture in mind. So our team for Whitehall, we have Kristen Kale, who actually now is president of Whitehall Manufacturing, not VP. She's in City of Industry, California, and actually may be popping in here at some point. Myself, I live in Rhode Island, and I'm national sales manager for sort of the eastern half of the country, but also for Canada. And Russell Gibson is our other person that helps out as we need. He's actually taking a couple days off, so won't be joining us today, but that's our small but mighty Whitehall team. So this is ligature resistant solutions for healthcare facilities. It is certified by AIA and ASPE for credits, also IDCEC if there are any interior designers out there. So we do offer credit, and it's in the health, safety, and welfare area. So as Zach mentioned, this session is being recorded. If you have questions, you can use the chat area, and we'll try to answer everything. We can actually provide this presentation afterwards as a PDF document. And I believe for Canada, instead of us sending in the information for credits, you may have to self-report. So if you don't get the information that you need, the credit that you need, you can contact us though. So yeah. Here's what we're going to be.
I'll jump in there just real quick. We're going to be having a follow-up email sent out to everyone. So we'll be sure to include the link to the PDF so they can click through and download that PDF link. And we'll include some of the information that in the body of that email so that they can get the credits figured out. So thanks for bringing that up.
Okay. Yeah, great. Thank you. So here's what we're going to talk about today. We're going to talk a little bit about the history of behavioral health facilities, what we call the mental health tsunami, overview of current guidelines, and a lot of this, you know, a lot of it is based on things here in the States, in the United States, but a lot of it carries over and is still used throughout Canada. It's amazing. Well, you know, when we get to this, I'll mention it, but how one thing in particular carries over is pretty amazing. We're going to talk about flexible design and then safe and secure fixtures and accessories, what you can actually specify, what to look for and what to use in behavioral health facilities. So here's sort of where behavioral health started. There was a person by the name of Thomas Kirkbride, MD, and he designed buildings throughout the United States. There were about 73 of these buildings that were built, and it was called the Kirkbride Plan. And they built these buildings. It's actually, even though it was in the mid to late 1800s, they're actually pretty good. The facility is spread out. You can see all the windows in that building, lots of access to views of the outside and natural light, which we'll touch on a little bit, is really good for patients and their care. These buildings held about 250 patients, and it was really innovative for its time. And there's still about 25 of these that exist today. And thankfully, as you see here in the picture, this building, the New Jersey State Lunatic Asylum, thankfully the name is updated, but I gave this presentation at an architecture firm in New Jersey, and one of the gentlemen there, his wife works at this building. It's still in existence because of, you know, the number of patients, natural light, views of nature. It still holds true that they're good today. But again, thankfully, they changed the names. So one of the pioneers in behavioral health was a gentleman by the name of Moses Shepherd. He was a businessman in Baltimore, a Quaker, working to abolish slavery, philanthropist, and he became the commissioner of prisons in Baltimore. And as in that position, saw how inhumane that people with mental illness could be treated. He was approached by a lady named Dorothea Dix to establish a state-run institution, got a charter from the state of Maryland, but instead created a private institution funded in large part from his wealth as a businessman. So, and he actually used that Kirkbride approach. It was called the Shepherd Asylum. Later, there was another gentleman by the name of Enoch Pratt that also became involved, donated about $2 million endowment to the facility so they could finish construction and, you know, really treat a lot more patients. Their whole idea was courteous treatment and comfort for all. They really worked. None of the patients should be below ground. They wanted them to all have privacy, sunlight, fresh air, and they wanted patients to actually get better, not just put them away because they, you know, should be away from society. And again, this building is still there. I was in this building back in September. And one thing that's really amazing, if you're ever down in the Baltimore, Maryland area, they actually have a museum in that building. And they have, like in the pictures here, it's the logbooks of every patient that's ever been there, starting from, as you see here, number one, really detailed descriptions of who they were, what the issues were. And it's a really fascinating museum to the history of behavioral health. So, so at one time, again, it was the Shepherd Asylum, then the Shepherd and Enoch Pratt Hospital, and now it's the Shepherd Pratt Health System. And they've really, really grown. They were the birthplace of occupational therapy. What they wanted the patients to do is get outside. They worked in gardens and in farming, get some fresh air. They provided some of the food for the facility, the actual patients did. And there were also leisure activities. They had bowling alleys, buildings where they could, get fresh air, be outside. And the Shepherd Pratt Health System is still at the forefront of research, a great deal of research that goes on there. They also really were a pioneer in getting care for behavioral health out into the emergency room so that when patients need care, they show up at a hospital, they can get the care that they need. They've also really expanded outpatient facilities. One of the first centers for eating disorders, and worked with primary care physicians, which is really important. You want your primary care physician to know what's going on for your entire well-being, not just physically, but also mentally. A great expansion of adolescent facilities and a full spectrum. They take care of patients no matter who they are. If they have private insurance, if they're on public assistance, they excuse me, really remain a pioneer in behavioral health and have been followed by other facilities around the world. And this picture here is one of their newest facilities, which is down near Washington, D.C. So we talked about health, primary care, behavioral health. What is health? It's a state of complete physical, mental, and social well-being. It's not just not being sick. Health is your complete body and mind. So behavioral health, interchangeable with mental health. It's all parts of psychiatric illness. It can take a lot of forms: depression, anxiety, also encompasses substance abuse and other addictions, and even, bipolar, schizophrenia, things like that. So there's a wide range of things that it covers. So what is behavioral health care? Again, depression, anxiety, really taking care of the whole body. And it really is an alarming social and health issue. For the Centers for Disease Control here in the States, in the United States, almost 46,000 suicides were reported in 2020, 10th leading cause of death for Americans. Of all the ways that people attempt suicide, hanging is the second leading method of suicide. And once a minute in the United States, someone attempts suicide. Really alarming. So 90% of the people that pass away by suicide really are treatable. So it's so important that people get the treatment that they need. And oftentimes it's unrecognized, untreated. They just don't have access to the right care. So that's really what's going on now, is trying to get people to recognize and know what care is available and how to get that care. So some things, again, here in the States, and I apologize, so much of this is based on what's happening in the United States. But some of this, there's the Commission on Mental Health, the Community Mental Health Centers Act in the 60s that started to get healthcare for behavioral health out into the community instead of those large buildings that we saw a few minutes ago. And the Mental Health Parity Act, this is still being worked on currently, and that's getting the same level of treatment for patients with behavioral issues as they have for physical issues. If you have cancer, you're treated until you're cancer-free. You get the treatment that you need. unfortunately, there's still limits to behavioral health care. It could be dollar limits or a number of days. And, it's just so unfortunate that people get the care that they need, but they run out of days of coverage before they're really better able to get back into the community. So that's something here in the States that's still being worked on. So the mental health tsunami, COVID really has taken a toll on mental health issues through unemployment, isolation, whether it's youth that couldn't be in school, grandparents that were isolated from the rest of their family, a lot of stress. So it's really taken a toll on just the general population's mental health. And you can see there's been different waves. There was the first wave, and this was what was reported by Shepherd Pratt facility again, the first wave of immediate mortality from COVID. The second wave was impact of resource restriction, where people just couldn't get to the care that they needed. There was the third wave, just how interrupted care was on chronic conditions. And then the fourth wave, which is still going on, psychic trauma, marital issues, mental issues, economic injury, and just burnout from COVID going on for so long. And where a lot of it ended up being was in adolescence and youth. Kids weren't in school, they were isolated from their friends and their peers, and it really took a toll on behavioral health among adolescents. It's really, really increased. And unfortunately, getting treatment for adolescents through COVID was really difficult. But it is being recognized. The Surgeon General here in the States and back in December recognized that symptoms of depression and anxiety have doubled throughout the pandemic. 25% of youth are experiencing depression and 20% anxiety. So there's really a push on to get adolescents the treatment that they need, whether it's in an emergency department visit, in the community, wherever they can get that treatment. And unfortunately, where a lot of this has fallen on is school counselors, and they're just overwhelmed. The counselors that are in middle schools, high schools, even grade schools are just overwhelmed with the number of students that they have to care for, and really being able to recognize symptoms and get people the treatment that they need is really important. Here in the States, we have, if you have an emergency, you can pick up the phone and call 911. Coming this year, you can pick up the phone and dial 988 and get someone that's specially trained in suicide prevention, or even, being able to help you find the care that you need. So this is something really important. Hopefully it's going to carry over to Canada as well. And, the reported anxiety, depression, and in particular, overdose deaths have really climbed throughout the pandemic. Both suicide attempts, completed suicides, unfortunately, and you look at this, the number of emergency department visits for 5 to 11-year-olds have gone up 24%. For 12 to 17-year-olds, 31%, really increasing a lot. So what we've had here is the Affordable Care Act and the American Rescue Plan. A lot of funding from the U.S. government going out to healthcare in general, and in particular, behavioral health. So what I understand, and talking to Jerry Babin from Morris Lee, and on another call that we did on this, so what I understand is a lot of it in Canada is up to provincial governments. The provincial governments are going to Ottawa trying to get more funding, but a lot of what's happening across Canada is really more on a provincial level and a local level trying to get increased funding for behavioral health, healthcare in general as well. So where here in the States, a lot of the funding is going is towards veterans, our military veterans, which on average in the United States, 20 veterans a day pass away from suicide. The largest, a large percentage of suicides are people that have been in the military. Unfortunately, they have care available, but it's still happening. So trying to get help out into the community and telehealth, care by telephone or by Zoom call is really being worked on. And our President Biden, his viewpoint is health is health, that he doesn't see a difference between physical health and behavioral health. So he's really working to get veterans the care that they need out into the community. And one thing that they're doing, I was on a webinar myself, and there's a group that's trying to get telemedicine where veterans, if they feel they need help, they can do a call like what we're doing today and be connected with someone that's a specialist in behavioral health. And what they're doing is they're making special, like a telemedicine booth, and they're putting these in, they have veterans halls throughout the United States. So a veteran that feels he needs help can tell his friends, family, whoever it is, hey, I'm going to go down to the VFW, the Veterans of Foreign Wars hall that's in their local community. They can go to get this telemedicine, and it helps reduce that stigma that, they just say, hey, I'm going down to the Veterans Hall. They don't have to say, I'm going for telemedicine, and they can get the care they need right in their own community. So some good things are really coming out of this.
Yeah, I would just jump in there. So, I know, you're talking about the increased spending, and I'm sure a number of our engineers on the line will likely have worked on some of the projects already that are coming out in Canada. We're certainly seeing a similar increase in budget attributed for that, not just in full dedicated facilities, but also within a larger hospital environment, having a section for behavioral needs areas as well. So we're seeing that integrated into the larger healthcare environment, similar to as you mentioned there.
Hey, Zach,
oh, that's great.
Can I take a second too? Hi, Steve. Sorry to say hi to everybody. Hi, Canada. Kristen here from California. Sorry I couldn't attend a little bit earlier. Zach, ATS, everybody, thanks for having us here. Yeah, no, up in Canada, I was just up there recently, and the whole thing with doing emergency rooms and things. I know that Steve's going to get into it. I just want to say hi. I'm here to help. Here to answer questions too. Like I said, I'm now on the left coast, so British Columbia, all that, Calgary. So anyhow, go.
Perfect. Thanks, Chris.
All right. Well, welcome, Kristen. Glad you can make it. So jumping into another area of where there's a lot of focus on behavioral health is in correctional facilities. A huge percentage of people that are in correctional facilities, whether it's federal, state, or local, have mental illnesses that they really need treatment. People are picked up on the streets. It could be substance abuse. It could be some other sort of behavioral health issue. And they're put in jail. They're put in prison. So we really need to recognize that need for treatment within correctional facilities. And here's what a correctional facility can look like. It doesn't have to look like a jail cell like you think of your typical jail cell. It can almost look more like a dormitory. And here you see it's a real bed, it's a real sink, a real toilet, and treating people with the respect that they need and making that care available to them is really important. So it needs to be recognized And people in correctional facilities really do need to have availability of treatment so they can get back out into the community in a good way.
Hey, Steve,
So,
one terminology I've heard just recently, and I wanted to throw this out because literally it happened last week. It's called trans-institutional. So that's what we're hearing, kind of the verbiage now. So prisons moving to mental health, and as you see, funding is pretty vogue now for mental health as opposed to a correctional facility, but it's, you know, kind of all encompassing now, right?
yeah, so that's a very good point. Thank you. So, as I mentioned previously, hanging is the most likely way that people attempt or complete suicides in facilities. And this shows, you know, hanging right there at the top, cutting with a sharp object, which we'll touch on a little bit. Unfortunately, still overdoses, but hanging is the number one way. So we really try to keep that in mind. And as I mentioned earlier, you can see, you know, that very first slide where you walk into the facility and it says hope. Whether you're a patient or a family member, a visitor, it gives you a really good feeling. And this right here is what we're trying to avoid. So this is about the opposite of hope, to pull up to a facility, and this is what you're seeing when you get there. So we really want to get away from this and work towards facilities that contribute to treatment, not that make people feel like they're just locked away from society. So interrupting the attempt. So a number of years ago, I read an article. It was written by a man whose son committed suicide by jumping off the Golden Gate Bridge in San Francisco. And they did studies. So at the Golden Gate Bridge, what they're doing is putting nets below it. So if somebody were to jump off the Golden Gate Bridge, which really is sort of a beacon or a focal point for people wanting to attempt suicide, unfortunately. So if they jump off, potentially they're landing in a net and can get back to safety. But what they found, not just Golden Gate Bridge, but anywhere, is if that suicide is interrupted for one reason or another, it can be something as simple as, like on the Golden Gate Bridge, someone saying, "Hey, what are you doing? People care about you. Let's talk." It can be something as simple as that, or it can be products in the environment. But if they're not successful, 90% chance they're not going to attempt again. So that's something really to keep in mind. What can you do to the environment that if somebody does want to attempt suicide, lessening the chances that it's successful and 90% chance they're not going to try again. So people with mental illness are 75 times more reactive to negative stimulus in the built environment. So if there's something that's annoying in that environment where they are, they're going to focus on that, and it can really interrupt their care. So you need to keep in mind zoning, urban planning, that, hopefully there's a view of nature. They can see outside, see some plants, some trees, get some fresh air. You need equity in design, and not just physical, but non-physical. It's things like spiritual care. Reducing the amount of noise in the environment is really important. And just, it's something I keep in mind with plumbing, that you want people to be able to, if they want to drink a water, want to wash their hands, brush their teeth, they're able to do that without even really thinking about it. They should have availability of a bathroom without even thinking about it, so it doesn't provide that negative stimulus that they're going to focus on. And here's, out in the community, you see signs like this now. It's okay to not be okay. No one should feel ashamed to talk about mental health. You really want to reduce that stigma, whether it's someone that's in school, an adolescent, whether it's someone in, related to their occupation. They find this with healthcare givers, that doctors, nurses are afraid to get treatment because they don't want their peers to find out. So we really need to work to reduce that stigma. So let's talk about some current guidelines. And first, let's just talk about ligature itself. You hear this, the very title of this presentation, ligature-resistant solution. So what is ligature? Ligature is defined as tying or binding. So what we're wanting to do is make the environment ligature-resistant so that patients in this environment can't tie or loop around something with something in their environment in an attempt for self-harm. Remember also that patient suicides are much more likely to take place in the inpatient bathroom. So it's really where you want to focus your attention. One thing, and this is what I was talking about earlier, the New York Office of Mental Health. And I hear about this, even though it's put out by the state of New York, I hear about it all across Canada.
Yes,
and we're going to touch on this a little bit.
It's not just in Canada, Steve, right? It's literally every day, every hour. I think we hear about the Office of Mental Health, and these guys are so prominent. But anyhow, Steve's going to go more into this. Steve, I just want to say Steve really does work closely with these guys, by the way, because he lives near there. So go ahead, Steve.
Yeah, so what happens is there's an architecture firm called Architecture Plus that's in the Albany, New York area. And all different manufacturers send their products there and they test them to see if they're ligature resistant. They use a lot of different things like a computer mouse, different kinds of shoelaces, headphones with cords on them. And they also use paper clips and a plastic knife. What they try to do is they use the plastic knife to try and wedge things like the shoelaces in a crevice. They use paper clips to try and get it stuck in things that they can then put a lace or a cord through to attempt ligature. So a lot of testing is done by Architecture Plus at the request of the state of New York Office of Mental Health. So what to keep in mind is everything in the room, floor to ceiling. I've had facilities managers tell me, oh, if it's from the knees down, you don't have to worry about it, which is just not true. You have to worry about everything in the room, floor to ceiling. So say you're called on to work on renovations for a hospital that's been just a regular hospital, not for behavioral health, or maybe it's an older facility that just wasn't appropriate for behavioral health. You walk into the patient bathroom and this is what you see. So how many objects do you see around this bathroom that you might need to worry about? So there's a lot of different things here. We counted at least 26 items in this room that are potential danger spots. So you have to keep in mind everything from the ventilation grates up in the ceiling to the floor drain. And we're going to talk about all of these in a little bit coming up. So here's where this comes into play. First, in the United States, is for a facility to receive payments from the government for treatment, whether it's for acute care or behavioral health. They have to be accredited. And there's a part of the U.S. government called CMS, the Center for Medicare and Medicaid Services, controls payments to facilities. And then there's a not-for-profit organization called the Joint Commission. What they do is they go out and inspect facilities, the physical facility, their policies and procedures, their outcomes for all different types of healthcare facilities, not just behavioral health, but across the spectrum. So they've been inspecting behavioral health facilities So I want to tell you about this, not because, you're concerned with it so much there in Canada, but the way they go about it. So when they look at a facility, they have high and low danger areas. The highest danger areas really are the patient bathrooms, because it's an area that's potentially between two closed doors. People have more privacy there, so there is more attention placed on, say, the patient bathroom than there is on something like a drinking fountain that's right in front of the nurse's station, with a low chance that something's going to happen there. And if somebody does attempt, good chance that somebody's going to be there and see them. So just keep that in mind for facilities where you should focus most of your attention. So Joint Commission, they're getting back out in the field now to do real inspections. They were doing it by like Zoom calls for a couple of years. So let's get back to Office of Mental Health that we talked about. They do put out a guidebook, and it's too large of a guidebook to email out. But if you just Google patient safety standards, New York State Office of Mental Health, you're going to get a link to this document, updated twice a year. And again, all across the United States and Canada, other foreign countries as well. We've heard about it in Asia. Everyone looks at this, and they cover everything that is in a facility. So what they would ask and what I'm asking, though, is if you do look at this, we get calls. I got calls from an engineering firm in Calgary saying, we're only going to use products that are approved in the state of New York design guidebook. It's really not even what they follow in the state of New York. This book is initially put together at the request of the Office of Mental Health to test and publish for their own facilities, not for everyone else. Because it's so comprehensive, it's kind of taken over. But they do recognize that it's never going to be possible to have every product available in the guidebook. There are constantly new products coming out. There's a lag time before they're in there. They don't believe that they're only going to use products that are in the guidebook. And so, anyone specifying products shouldn't believe that either. And if a product is not in there, you just need to look at it and see if it's appropriate for the facility. It's always the responsibility of the hospital to decide what's appropriate, not just by looking about whether or not it's in the patient safety standards.
I think that's an important point as well. We have had a couple of output specs from healthcare groups where they may reference that specific approval, but ultimately it does come down to the individual healthcare group and their internal standards team, similar to their IPAC team, that may make that decision.
Yeah, so I'm going to back up. Here's a good example of that. Dispensers that go on the wall for rolls of paper towels. A roll of paper towels like you would use in your home. They're never going to use those in the state of New York Office of Mental Health facilities. So they don't take the time and effort to test them. It doesn't mean there's anything wrong with it. They're never going to use it in their own facility. So it's just not in there. Not because it's a bad product, just because they're not going to take the time and effort to test it when it's something they're never going to use. So just keep that in mind when you're, someone's throwing out, it has to be in there. There could be a reason it's not in there. One design guide that's pretty good, not as much, there's a few products in there, but mainly for how to design the actual physical building with the nurses' stations, sight lines when you're in a doorway to a room, being able to see the whole room and without corners that people could hide in, things like that. The Department of Veterans Affairs from the U.S. federal government has a new guideline that's just a little over a year old. Again, mostly for the actual building, but some good things in there as well for some fixtures. And what's followed a lot here in the States is the Facilities Guideline Institute. They put out a number of different publications for guidelines on building acute care hospitals, behavioral health hospitals, outpatient facilities, extended care facilities. And for just the past few years, there's been part of it is for behavioral health. They just now have new guidelines coming out. It's put out every 4 years. It's just now coming out. And what they did is they took a publication that was done by some of the pioneers of the industry, David Sine and Jim Hunt, and rolled it into FGI because it was such a good publication. Again, it's followed by the majority. As I mentioned, it comes out every 4 years. The majority of states in the United States follow one version or another of this, but it's something good to look at because there's so many different suggestions and ideas of how to design for behavioral health. So I mentioned earlier, universal design. You do want patients to have views of nature, access to fresh air and daylight, but there's a lot of other things that go into the design for behavioral health. When you look at this room, it doesn't look so much like a behavioral health patient bathroom. It looks like it could be a patient bathroom in any facility. It doesn't have that stigma that you're in behavioral health. And also in something like a pandemic, if you need additional rooms and you have behavioral health rooms available for pandemic patients, anyone can go in this bathroom and not feel that stigma of what kind of room they're in. It can be ADA accessible, bariatric, available for bariatric. You want to reduce infections through the design, aesthetically pleasing, designed really for anyone that can go in there. And you want to keep in mind when you're designing, if it's for retrofit, you want it to work for retrofit, and you want it to be relatively quick to install so you can turn over that facility pretty rapidly. So a lot of challenges for facilities. Again, as we talked about the influx in behavioral health, you need it to be ADA, bariatric, and infection prevention. So keep this in mind. You don't want cracks and crevices in things like sinks. Anytime there's cracks and crevices, mold, mildew, bacteria can grow there. So try to keep things seamless. Here's a good example of a sink where the backsplash and side splash are integral, no cracks and crevices, easy to clean. You don't want bacteria and mold and mildew to grow there. So you want it easy to clean. Keep that in mind. So let's talk about the actual fixtures. First, section 22, plumbing fixtures. So for behavioral health, and just across the board, whatever guideline you're looking at, toilets need to be floor mounted and go back to the wall. They shouldn't be wall hung. There shouldn't be a gap behind the toilet that patients can loop or tie around. A lot of times, unless it's adolescent or juvenile facility, choose ADA height. It's just easier for the patients. Toilets can have wall or floor waste outlets, top supply, or a recessed wall supply. Everything is available. So again, you want it flush to the floor and the back wall. According to the guidelines, vitreous china toilets are acceptable in facilities, but you're really running a risk when you have that instead of a stainless steel fixture that patients can break break the toilet. And that second leading cause of death in facilities, cutting. You have a vitreous china toilet. When it's broken, you have a great chance that there is something available either for self-harm or harming others. So again, although they're acceptable, I would recommend you shy away from vitreous china toilets. So here's those, the water supply, as I mentioned, top supply, recessed wall supply. They can be push buttons, they can be sensors. Here's a good way to do it. You can have a sensor. You have access panels above and below the grab bar. You want the grab bar in an ADA accessible spot by having high and low access panels with the grab bar across it. You can take either of those panels off for maintenance, and it's a good, clean way to do it. So a little bit of a new way. Also, you can get this designed with a hydraulic flush valve with a push button. So sinks, solid surface is a good way to go. Really is unbreakable, and it looks a lot better. And again, seamless. You can have a single sink that goes in a corner that's just hung on the wall. You can have dual sinks where you have more of a dormitory or shared room so that there are more than one sink available.
Does that happen a lot, Steve? Do you see dual occupancy in facilities now?
I'm sorry, what was that?
Do you see dual occupancy in a lot of different designs now?
Yeah, and actually for veterans, it's kind of recommended that they find that veterans, military veterans, they're kind of used to the buddy system and they really like having a roommate. So that's a lot of veterans facilities. You see those dual patient rooms, and nice that each of them would have a sink. And then if you need it, high security areas, stainless steel sinks might be, and bariatric rated might be a good answer. But for any of them, ADA accessible. For faucets, a lot of different types available, push button, sensor faucets, touch button faucets. But one of those guys I mentioned earlier that was a pioneer in the field, Jim Hunt, he was always giving us recommendations. And when he saw the bottom middle sensor faucet there, he liked it. But his challenge was have a sensor faucet that supplies both hot and cold water. And you think about it, if you're a patient in a facility and anytime you want to drink a water, it's tempered or warm water. You want to wash your hands, it's not hot water, it's tempered. You want to brush your teeth and it's warm water. Give the patients availability of both hot and cold water. Such a simple thing, and patients really do appreciate it. And when they do patient surveys, that's something that shows up. And you know, you want to drink a water, you want cold water typically. So give patients a choice of temperature and do dual temp.
One of the questions that I've got on a lot of the faucets comes into those dual temp. Is it, you know, a full on hot and then a full on cold, or can you blend them?
Depends on the faucet. Sometimes you can do both. Sometimes it's one or the other. It depends on which faucet it is and the way it works.
Perfect.
So moving on to showers, you can have all the shower valve recessed in the wall with a panel that you can get to everything when you need to. You can have the individual parts in a solid surface or a tile wall, or you can have it surface mounted. That on the bottom there, sort of in the middle, it's a unit that mounts on the wall with a slope top, so you can't tie or loop around it. So a lot of different varieties available. High and low shower heads with diverters. A lot of choices. And one thing we're being asked about more and more are ceiling shower heads. So keep an eye out for those. It really works well for patients that need assistance in the shower, that the caregiver is able with a ceiling shower to move around the patient without getting as wet. So those are a good choice. Here's something that may not make sense to you, a hand shower, but here's the way it works. When patients need a hand shower, there's almost always going to be a caregiver in the room when they use it. Then when the patient's done, you take away the hand shower and the hose, and what's left on the wall is safe to be in the room that you can't tie your loop around. So hand showers are really good for not just older folks, but for juveniles as well. And if you ask a facility when it's used, there's always going to be a caregiver, and they always take the hose and hand shower away when they're done. And then moving on to, as I mentioned before, the floor drain. Patients really have, and I've heard this from facilities people, patients get fixated on floor drains. If it's your typical grate, they can take a lace or a cord and weave it through that floor grate. The grate that you see on top of this, each one of those slots is isolated from all the other slots, so you can't tie or weave something through there. And at the bottom there, you see a floor drain that's used with a one-piece vinyl floor. And then the flooring actually becomes part of the drain between that vinyl floor head and the flashing pan. So the flooring material is secure as part of the drain. It's not going to be picked out or come loose. So vinyl flooring is much more popular now. So keep an eye out for those vinyl floor drains. And another type of drain, linear drains. Facilities people love linear drains because with just a small drain, the patients can cover the drain over with their hands, with a face cloth, with a small towel, potentially flood the room, the patient room out into the hallway. With a 4 or 5 foot long linear drain, it's harder to get that flooding. So, and again, those are available for vinyl flooring. So something that's gaining popularity in facilities. And also shower basins with an integral trench drain that's also ligature resistant. A really good look, very clean, nice way to do it. Very vandal resistant, ligature resistant, a good thing to do. So keep in mind the shower pans. These are solid surface that you see here. And drinking fountains. Again, just like the sink, patient satisfaction really increases when a patient wants a drink of water. They can get it on their own without having to ask for it. So make sure you have water available for the patients. Moving on to your accessories, and we're getting towards the top of the hour. So this may go a little quick, but again, this will be available afterwards to you to go through it at your leisure. So grab bars. You have to have grab bars in facilities for ADA, and I know a lot of the provincial regulations say you have to have them. They do need to have a way, though, for water to drain out. They're made in a way that you can't tie or loop around the grab bar, but water still has to get out, especially in the shower. So hidden holes in these for drainage it's really very important for these grab bars. So make sure that they have that. Shelves, patients need a place to put their stuff. This is a semi-recessed shelf. It can go horizontal. It can go vertical. You can even use these not only in the bathroom, but this could go over a bed so the patients have a place to put books and other belongings. But it's also appropriate for the bathroom. And mirrors. This mirror that you see here, the stainless steel, has a stainless steel surface that's mirror polished. And again, with shelves on the side, so you have a place to put your stuff. There are also mirrors available that don't have the shelves, but have either a solid surface or for high risk areas, a stainless steel frame around it. And again, mirror polished stainless steel. So the reflective surface is unbreakable. For toilet paper, you can't have the spindle in there for the toilet paper roll like you have in your home. That can be tied or looped around. So the one that you see here, it just has a place to put the roll of paper toilet paper. No spindle, nothing to tie or loop around. A really good idea. It's solid surface. It fits right in with all the rest of the things that go into that patient bathroom. Looks like part of the environment, not just something thrown in there. There are a variety of other paper towel and toilet paper dispensers, though, for C-folds. Some of them have a built-in soap dish. The ones like at the bottom left have spring-loaded buttons that hold the toilet paper or paper towel roll in there, but you can't tie or loop around thing. And then access panels. You always have things that you need to put back in the wall, whether it's electric, for sensor faucets, valves, things like that. So access panels are really important. As you see here, it has 2 locks, so you can't pry open the corners to tie or loop around it. And fire extinguisher cabinets. You know, certain things you just don't think about, but you do have to have fire extinguisher cabinets. These are either recessed or with a slope top, so they can't tie or loop around it. And one thing that's becoming more and more popular is water management. Facilities want to be able to control access to water. Sometimes there's a patient that might take a 2-hour-long shower or just leave the shower on and go back out of it. So you want to have a way to control remotely showers, sinks, toilets. Some patients, again, get fixated, will just stand there and flush the toilet all day long. You can control either a single fixture, a room, or even an entire wing of a hospital or a behavioral health area. So water management is something to think about. The number of flushes an hour, just being able to shut off the water when you want to be able to shut it off, either from a computer at the nurse's station or remotely, perhaps out in the hallway. So we want to focus on the overall patient experience. And again, the patient bathroom is where most of the suicides happen. So that's what we focus on, everything that goes into the patient bathroom. So this is sort of the end of the presentation, right at the top of the hour. But it's really what we focus on: safety, durability, and the aesthetics. You want everything to look good together. You don't want it to look all hodgepodge, like it's just something thrown together from all different manufacturers. So keep in mind, Whitehall, we do have everything for the patient bathroom. We do back up what we say. We have resources for everything that's been in the presentation. So just real quickly about Whitehall, we do have a newsletter. If you go on our website, whitehallmfg.com, there's a tab there that says Learn, and we have a newsletter where we interview not about our products, but about behavioral health in general. And we go to the experts. And up in the top right there, Michelle Cohen is a person that I met one time when I was there in the GTA. She is a behavioral health architect in the GTA. Go on there and read about what she focuses on, and really a lot of interesting viewpoints on behavioral health. And some of the pictures that you saw are part of the Best Care by Whitehall Dignity Suite. We want to make a good environment for the patients, that they feel like, you know, maybe not home, but it looks really nice, and it's not going to interfere with their treatment because it doesn't look so institutional. So look at our Dignity Suite. It's there on the website. And we'll bring the presentation to you. So we're kind of booked up for this summer and fall, but we have mobile showrooms that we take to conferences and conventions. If you happen to go to the ASHI conference in Boston in July, Healthcare Design in October, and the Healthcare Facilities Symposium in late September, we're going to have a mobile showroom there that highlights a lot of our products and also shows off something called a vacuum waste system from another one of our sister divisions, Acorn Vac, a different way to handle septic waste in a facility. So keep that in mind. Keep an eye out for our mobile showroom, either at a conference or we will get this scheduled to come out to you. So a big thanks to everyone. Thanks for your time. Just a couple minutes over here, but thanks for attending. If you need more information, you can contact us. It has Kristen's email on there. Jerry Babin, the folks at all the agencies that represent Whitehall across Canada can help you out anytime. ATS knows where to track us down. So thanks again, everyone.
Thank you, Steve. That was great.
Hey.
You know, I think there's a lot of great information there. And as you mentioned, we'll be having the follow-up information get sent out shortly. That'll include the copy of the presentation, like you mentioned, and of course, the information about the CEU. As well with that, if you do want to get, you know, some of the experts taking a look at maybe your internal office standards, certainly reach back out to us. Jerry and I will be happy to do a meeting with you, review what you currently have as maybe your mental health master or your healthcare master. And of course, we'll bring Steve in or any of the other contacts at Whitehall that were, you know, shown at the start there. So thank you very much for your time today, Steve and Kristen. Thanks everyone on the call for joining us. Really appreciate it. I think this has been another great ATS University, and we're looking forward to the next one. Have a great rest of the day. Bye for now.